Hello, everyone. It's Friday, June the 5th. I've got to start off with some not so good news. In fact, it's terrible news, but we've lost 4 more West Virginians, a 62-year-old male from Roane County, an 82-year-old female from Jefferson County, an 88-year-old male from Jefferson County, and a 52-year-old male from Jefferson County. That makes our death toll in the state of West Virginia 82. And I just hate this. I mean, that's all there is to it. And naturally, if I could wave a wand and make all this go away, I'd do it. I'd do it as a drop of a hat. I want everybody so much to not just become numb to these numbers. They're people. They're West Virginians. It's bad enough that you're losing, an 80-year-old plus person, but we've lost a 62-year-old and a 52-year-old as well. We've lost a lot of knowledge, and we've lost a lot of just goodness that these great people have brought. And please keep their families and all their loved ones and them in your thoughts, your prayers. Prayer is really powerful, and I'm sure a believer in all the blessings that God above has bestowed upon each and every one of us, and one of those real blessings is our abilities to pray. And so please do that for all these people. And in addition to that, we have Senator Bill Hamilton, who is a great friend, is a great servant of this state and everything, and he lost his son. And so please also keep Senator Hamilton and all these people in your prayers. Kathy and I will do so, and let's just all, as great West Virginians, join in that to where the prayers going up will be numerous for all these people and all their loved ones and everything. In some way, somehow, they'll get through it. This is week 6 of what the West Virginia Strong Comeback Reopening Plan. A round of reopenings begin today on June the 5th, and you'll see them right up there. There are casinos and movie theaters. Week 7 will begin on Monday, and there's the things, with our low-contact youth sports at WV, SSAC, athletics, and bands, and our little leagues, we'll all be able to begin on Monday, June the 8th, as far as our practicing, and the guidelines are all up there as to when they'll be able to play and what they'll be able to do from that. Also next week on Wednesday, our private and state park campgrounds will be open to out-of-state guests. Today I'm signing an executive order formally allowing the reopenings for week 7, and guidance is up on our website, and guidance is also available on our website now for our fairs and our festivals. And this guidance also applies to our amusement parks and rides as well. So, I think if you'll go to our website, you can find all that. On a really good front, we've been encouraging our cities and our counties to apply for the CARES Act's money. And today I am happy to announce that we have a plan now in place for payroll reimbursement for our cities and our counties. Now, this is not just opening the floodgates to one size fits all, and we've still got guidelines that we've got to apply and we've got to meet and everything. But this is the thing we've been waiting on. And this is the thing from the legal community that we've been waiting on. And this will begin the release of millions of dollars of funding that will go out starting next week. I have told our people in the Department of Revenue over and over and over, and I just got off the phone not long ago with the municipal leagues. But I told them just this: it's high time that we backward engineer this thing, and because we're not getting anywhere. And absolutely, you know, I hate to say it this way, but I set on everybody, you know, because in all honesty, we weren't getting to where we needed to get to. And so what we've been able to do is we've been able to get the legal opinions that we've been looking for. These rules are vague and they're difficult and they're very, very cumbersome. And so, but we've gotten to where we need to get to now. And so, you know, like I said over and over, you know, that these funds now can start really flowing. We need more and more applications and everything. It won't be carte blanche where you get everything, but it is significantly better than we were before, and there'll be tons of monies that will be flowing out to our cities and our counties. I could not be happier about that. We've only received 31 applications so far. You know, we need more and more applications from you, and like I said, this has been a top priority of mine from the very get-go. But the restrictions were so tough that we had people that were applying for, pick a number, $100,000, and all we could get to qualify was $800 of that money. Well, I mean, all we were ended up doing was frustrating a lot of people on both ends of the spectrum, and so now I think, you know, we can really turn loose with some real money coming to these counties and the cities, and they need it. And the only thing I would tell you is, again, you must comply with the guidelines, but the guidelines have broadened, and we'll be processing your stuff very, very quickly. Please get it to us. I want to go back to the reopening. No, we've already done that. We don't have to go back there. I want to now jump to our free testing and everything. This was primarily targeted at our African American communities and everything to get more data there. We all know that we need more data because we all know what's happened on a national basis and everything, you know, from the standpoint of, that the African American community had a disproportionate of deaths in regard to this terrible pandemic. And so the more knowledge that we have, and the way we get knowledge is testing. So please come out and get those tests, and the same for any vulnerable people or anybody that is looking for a test, please come, okay? Today and tomorrow we'll be in McDowell, Ohio, and Harrison counties. We are announcing today that next Saturday we will also be in Greenbrier, Hancock, Logan, and Wood counties. We've already announced that next Saturday the 13th, we will be in, a week from tomorrow, we will be in Grant, Hampshire, and Hardy counties. We have already announced that, I think, you know, but if we haven't, again, on Saturday, June the 13th, we'll be in Greenbrier, Hancock, Logan, Wood, Grant, Hampshire, and Hardy counties. And all this testing is free. It's painless. You're in and out in 10 or 12 seconds and everything as far as the administering of the test. And it's done by our local health departments, DHHR, and the National Guard, and I thank them more than you'll ever know. Now, let me see. On our jails update and our corrections and everything, our corrections department has now tested 15 facilities in 3 days. That's nearly 3,300 tests of inmates and juvenile residents, you know, and more than 1,700 employees have been tested. 2 more facilities are being tested today. The results that have come back thus far are on 550 inmates and residents. Everybody was negative with only 3 positives. We had 1 positive inmate in the Eastern Regional Jail, one positive inmate in the Potomac Highlands Regional Jail, and one inmate positive in the Martinsburg Correctional Center. All were quarantined, and this testing enables us to just do exactly what we ought to be doing. We're right on top of it. We're protecting these people in every way, and absolutely we're able to shut it down before it just eats us alive. You know, of nearly 400 employees that were tested, we had one come back positive, and they are quarantined now at home. And all the positive cases that we have so far are in good condition, and to be perfectly honest, they are without symptoms. And so the 3 inmates, like I said, that were tested positive here are quarantined and isolated in their facilities, and today we're joined on the call by Betsy Jividen, and Betsy, will be available in just a few minutes for any questions that may come up. I want to go back to our summer feeding map project that we announced. I want to remind everyone that our new West Virginia Strong Summer Feeding Assistance Interactive Map is up. This map was created by the National Guard, the Department of Ed, the Bureau of Senior Services, West Virginia VOAG, and United Way, and it is absolutely there to accomplish exactly what I've said over and over and over, and that is just this: we have got to take care of our seniors, our kids, anybody. We have got to try to feed our people. People that are hungry, it is so sad. And so if you're having trouble trying to figure this out, dial this number 211, and they'll help you to identify exactly where the sites are that are close to you and assist you in every way. I remind everybody again about the census. I've gone over and over and over, but we've got to be counted, West Virginia. Please, if we could just have the help of those out there to just absolutely adopt a community, adopt a street, just help me get us counted. Really, really, really important. I think the only other thing I have to report is just this, and I don't normally go and report to you on a national basis, but I think this is so worthy to report. Today in the U.S., we announced an increase in jobs of 2.5 million jobs in the month of May, and our unemployment rate as a nation fell back down to 13.3%. It's still dramatically higher than where it was, but what it shows us, with the biggest jobs increase in a month in our state's history, and that in our nation's history, and that's expected, from the standpoint of the number of jobs that we lost with this terrible pandemic and when they'd come back. But what it's basically saying to us is, we're coming back faster than what we expected to do. The stock market's way up today. I know we still got lots of people that are out there hurting, but we need some good news. We need to feel better about a nation and everything. There's so many things that are going on. George Floyd, just despicable incident that happened and everything, ripped our nation's guts out and everything, and rightfully so. I mean, it was just flat murder. There's no way around it. Other police officers stood by and watched, and it's just hideous, to tell you the truth. And so as our nation tries to heal, get better, improve the way we do things and all that kind of stuff, I just wanted to give you some good news about people going back to work, and our nation actually maybe doing a little better than what people thought was going to happen as soon as it happened. So we still got a long ways to go. I would be first to tell you we still got a bunch of rough road and a bunch of stormy seas in front of us, but we need some good news as a nation. I mean, you know, I've always believed that enthusiasm is contagious, and you know, we need some good news. So with that being said, I don't really think I've got anything else. Well, I do. I want to tell you about our charts. I always tell you that real quick. The daily, you know, from the standpoint of our charts, if we could get those up, you know, our daily rate, which is the middle line, our daily rate was less than 1% again. It was at 0.8. It was at 4/5 of 1%. You know, so that's fantastic. Our cumulative numbers dropped a little more. Now it's at 1.96. All good. You know, you know, if you'll just go back, and like I said, the easiest way to do it is go back to the 1st of May and transition all the way through to where we are today. That top line shows you at the 1st of May, those lines were almost together. At that point in time, we had 525 recovered cases, and we had 503 active cases. And you see now where we are now today, we're at 1,425 recovered and 606 active. So we're still continuing to widen, and that's exactly what we need to do. What we want to do is get everybody well. We want a situation to where we'll have a vaccine, and we want a situation to where we don't have any more, you know, coronavirus cases positive. And so that's all I've got right now. I think we're moving in the right direction, and we'll keep on trying to go north.
All right, thank you, Governor. First, let's go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. As the governor pointed out, we're supporting this weekend our partners with testing lanes. Also want to give you an update on our Challenge Academy program and cadets. 100 cadets are now going through the process of testing for their final passage at Challenge, as well as high school diploma option. 41 of our cadets have decided to roll into the next class and continue there. And unfortunately, we've lost 8 of the cadets. All of the cadets who go back to Dawson for testing are being tested for COVID-19, as well as a drug test. And we've got a lot of work going on from faculty and staff over the last couple of months to help those cadets be prepared to pass their exams. Jordan, if you would, we've got a quick video that we'd like to show folks just to give some perspective on the work going on for Challenge Academy.
I've never been very good at like focusing and learning in a traditional like school environment. So I decided to try this, and it actually kind of worked for me.
It was weird, and I didn't want to go home too. Like, I just did not. It was like I was so used to this routine, and then just being like, okay, go home. I was just like, oh no.
Our mission here is important because it allows these kids the opportunity to come back in after their hard work and complete their testing and get their high school diploma, and allow them the opportunities that they might not have been able to had we not been here.
It was just a great experience overall. Like, I got a lot of opportunities that I wouldn't have gotten.
So a lot of great work by staff, faculty. The cadets have really doubled down and made it through these challenging times in the pandemic, and we're exceptionally proud of all of them. Also want to remind folks that tomorrow is the 76th anniversary of the invasion at Normandy. Just on one beachhead alone, Omaha Beach, 2,000 Americans gave their lives to stop the oppression of Nazi Germany and the terrible things that were going on in the world at that time. So what I'd ask all of us to do, both for those challenge cadets who are working hard to turn their lives around and make success of themselves and their future, as well as out of respect for those who made the ultimate sacrifice to do away with tyranny, or attempt to do away with tyranny in our world. I think it's important and incumbent upon all of us to double down both in our response to the pandemic, as well as the challenges we face, and pay respect to those by peacefully protesting and expressing our opinions, as well as working hard to take care of everybody in these challenging times. Thank you.
Thank you, General. Next, we'll go to Dr. Clay Marsh, our coronavirus czar.
Good afternoon. I don't have a tremendous number of things to say today, which for many will be a treat. But I do want to point out that in our internal assessment, our R-T value, not R-naught, but R-T, which takes into account the people that have been infected and recovered, as the governor pointed out, is down to 0.6865, which is a really good number. Again, under 1, it suggests the virus is not spreading and is starting to reduce, and over 1 suggests the virus is spreading and gaining steam. Some people have wondered, as we see more cases that are identified in the state of West Virginia, and the governor pointed out the people who have died in the last 24 hours, how do we continue to assess whether or not it's safe to open up? And I would say that the RT values that we have for the whole state and have for every county and every region are part of what we're looking at, and an important part. But also, as we increase our testing, and the governor has articulated the places that we're offering free testing, we know that we'll find more COVID cases, and that's great because we know a few people can spread to many, the super spreaders. So the more people we identify, the better. But we're looking at that rate of positive cases that we find. And the rates still, as the governor said, at the cumulative level and even at the daily level, other than our spike that we saw for Huttonsville, has remained pretty steady and around that 2% range. And so as long as we're seeing that maintain, seeing the hospital capacities maintain, seeing our RT values still under 1, then we carefully watch, communicate, of course, and interface with our experts, the DHHR, with Secretary Crouch, Commissioner Slimp, and our great people at the local health department. So I think so far we're doing well. Internationally, though, worldwide, COVID is growing at a faster rate than we've seen before, over 100,000 new cases a day. So it's really important that we not get complacent. And West Virginia, as long as you keep doing what you have done, be careful, wear your mask, stay distance, we'll be able to continue to do well through this pandemic. I'm confident. So thank you.
Thank you, Dr. Marsh. Also joining us today is Betsy Jividen, Commissioner of the West Virginia Division of Corrections and Rehabilitation, also Secretary Bill Crouch and Dr. Kathy Slimp from the West Virginia DHHR. Once again, we are holding today's briefing with media members joining us virtually to practice good social distancing. The first questioner today is Steve Adams with Ogden Newspapers.
Yeah, this is Steve Adams with Ogden Newspapers. I know you're meeting with your revenue officials. I think you had a big meeting with them Wednesday afternoon and trying to kind of nail down what money you're looking at as far as the end of the fiscal year. I know you seem pretty confident in that. I've heard it told, and I've reported this in a recent article that I did about it. There's a couple Republicans that have put out the idea that the excess Medicaid surplus funds that we have could be used as a potential backstop, either use some of that money or just borrow from it and put that money back once we get past the fiscal year, once we see what the income tax filings look like for July. Are we thinking about using any of that money? I know that was the same money, $150 million's worth, that was going to be put into a lockbox. I know that legislation didn't make it through, but are we considering using Medicaid surplus funds for budget backfill? Thank you.
Sure, Stephen. You know, there's lots and lots of different ways to get through this. You know, let me say, absolutely, we're considering using those dollars and everything. From the standpoint just of this, the Medicaid match has gone up, and I'm not an expert on this, but I think the percentage level was raised, I think, to 88%. So we're growing an additional dollars in Medicaid right now. So really and truly, when it really boils right down to it and everything, we could use those dollars and not hurt ourselves hardly at all in any way. And so in addition to that, there's ways that you can actually, if you got in a real, pinch, you could borrow dollars and then repay those dollars back to the fund of that 1.25 billion that's come to you. We don't have to do that, but at the end of the day, the way this thing is trending right now, without any question, cash-wise, we're going to be fine through the end of June. And what is happening is, there's a multitude of things that are happening, and I don't want to get down in the weeds too much because it gets too complicated, but the net of the whole thing is there's more dollars coming in, than what we expected. There's absolutely the easing of the guidelines is enabling us to pay back some expenses that we already incurred and dollars went out the door. And, the other vehicles, that are available to us and everything are enabling us to get through the end of the year cash-wise in good shape. Now, and beginning in the 2021 year, you mentioned there was a meeting on Wednesday. We've met every day. Every single day on this, and we'll meet today. We'll meet today at 4:30. I give them the course of the day to try to see if there's anything else that has come out from the federal government and everything, because as we continue to update, believe it or not, the federal government, through all kinds of different grants and all kinds of different, buckets, whether it may be for higher ed or K through 12 or hospitals or whatever it may be, as we continue to update, there's dollars coming out of the federal, out of the federal government that are coming to us, and they're enormous dollars. They may be $121 million coming, or there may be $17 million coming, but nevertheless, there's real money coming. And none of this is for the pure backfilling of revenue. So what I'm saying to you now, we're not really betting on the come. Now we're betting. We're not betting. We know that we've got till the end of the year covered, and going into next year, I think we're in good shape.
All right, thanks, Steve. Next, we'll go to Brittany Patterson with West Virginia Public Broadcasting.
Hi, yeah, Brittany Patterson from West Virginia Public Broadcasting. I was wondering if, Governor, you could talk a little bit about the ability counties have specifically to slow down reopening if they feel like that is necessary. And I know we talked yesterday about the Eastern Panhandle. We talked to a health department official there yesterday who sort of urged caution with reopening. And so I'm wondering, do counties have that ability to slow down? Thanks.
Brittany, I have only one way to respond to your question and everything, and it's just this. All of us are concerned. We've all been concerned all along. As we continue to try to reopen things of which we know we have to do, just think for a second about this. What if we had not reopened hardly anything? Right now there'd be so many rocks coming our way, it would be unbelievable. You would have factions that would have divided in every way under the sun. West Virginians have pulled this rope all together from day one, and I have tried with all in me to keep us together. And dividing us would be the wrong thing. Now, do we listen to certain areas of our state, and do we listen to our medical experts and everything that says maybe, just maybe, in the Eastern Panhandle, we shouldn't be doing something there that we're able to do right in the central part of the state? And do we listen to our local health departments and all those people? Absolutely. Do we want that constant feedback? No question we want it. Are we constantly concerned and worried and everything? Absolutely. You know, and what we're trying to do, just to tell it like it is with no playbook. See, there is no playbook. There's never been a playbook to this pandemic. None of us that are living today have ever seen anything like this. None of us. So with no playbook, what we're really trying to do is watch these numbers nonstop that I report to you all the time. Watch these numbers. Listen to every medical expert all over the place, not only just in West Virginia, but listen to the medical experts on the federal side. Listen to the great people at all these wonderful hospitals, these institutions that I have contact with nonstop. And as they input all this information, then when it really boils right down to it, you're still going to the edge of the pool. You're sticking your toe in the pool and you're deciding whether to get in the pool or not get in the pool. But we're absolutely easing into the pool. We're not cannonballing into the pool. We're easing into the pool everywhere and watching all of the numbers that we possibly can and listening to all the people to see that if in fact we have waded into the pool and we're into the pool up to our knees and we've got an issue, then we move out of the pool, or we back up, or we slow down, or we stop, and then we go forward from there. That's the way we've played this whole thing. And so, sure, I'm concerned. I'm always concerned. And sure, we want more and more and more feedback, and we welcome it. So, Brittany, your question is great, and it's very, very valid, and it's what we go through every single day.
All right, thank you, Brittany. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Thanks for the time. This is a question for Dr. Marsh and Dr. Slimp. How accurate are the tests that are being given? We hear anecdotal stories of false positive, false negative, people who test positive and then test negative. Could you give me a percentage of how many tests are in question or how reliable these tests are?
Go, guys. That's y'all.
Go ahead, Kathy, you start.
Sure. No laboratory test is perfect. And so you always are, and there are many factors that affect laboratory tests, how they're collected, what the test is run, et cetera. We tend to see with the diagnostic test, the PCR, is probably more false negatives, things that are missed in picking up, than false positives. But again, we certainly are also seeing cases where there are potential false positives or picking up things that may not be as infectious as we might think otherwise. So I think there's nothing perfect about them. They are pretty strong tests, and we continue to improve following that over time.
If I could just add one more thing. So the other issue is that there's a second kind of testing called antibody testing, which is looking at people who are immune. And that is a much less good test for us to use in West Virginia because we have such a low number of people that are positive for screening. And so the genetic tests, the COVID tests that we're offering free are very good. If you're positive, you're positive. And I think Dr. Slimp certainly answered that part very well. But the other part is the antibody test, and that's evolving, but it's better when you have a lot of disease in a population as opposed to a very little amount of disease in a population.
All right, thank you, Paul. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11 in Charleston. Governor, I'll have a follow-up to a question I asked yesterday. The City of Hurricanes mayor has announced that city will celebrate the 4th of July with a parade in its town. We talked yesterday about the Ripley 4th of July celebration. I know you addressed it, but I couldn't tell if Ripley and other cities around the state are getting the green light from the state or if it's something you're looking at. And I'm only asking because I've been contacted by many people who say if you're rightfully going to allow demonstrators and protesters to exceed the 100-person limit to show their views and their thoughts about the current situation in the country, that the same right and privilege should be given to people who want to celebrate the birth of the country on July 4th. And so could you specifically address the Ripley 4th of July situation, other parades and say, yes, those are a go, or we are still not sure those are a go? Thank you.
Kenny, I'll do that, and I thought I did that yesterday, but they absolutely have the green light to go. There are guidelines on the go part, but they absolutely have the green light to go, and we hope we have wonderful 4th of July celebrations of our birth, and I couldn't be more excited about the being able to do that. We've got to be careful, and we got to be smart, and we've got to do all the things that we've been through over and over and over. And there's guidelines that are out there, and so absolutely, you know, we'll be working with the local officials and all the people, you know, that are pulling all this off, and especially working with the local health departments and everything to be able to have these celebrations and everything. And I think the people that are planning these events and everything, they've been great to work with. I know Mayor Rader has been absolutely great, and it has been you know, this time is a great celebration, no question, all across our state and our nation. But you know, I've got to say this, you know, it's a really special celebration in the town of Ripley, and so Mayor Rader's done a lot of good work there.
All right, thank you, Kenny. Next, we'll go to Anthony Izaguirre with the AP.
Governor, I'm not sure if I heard an answer there on if you plan to take money from the Medicaid surplus to balance the state budget. Is that something you're considering?
Absolutely, Anthony. You know, from the standpoint of, you know, the Medicaid surplus, the Medicaid reserve fund is a surplus of dollars, and as we continue to go forward, the match that's coming in, the Medicaid surplus fund is just going to go higher and higher and higher and higher and everything. And so if we need to take some dollars out of that right now to backfill and everything, absolutely, that's on the table to be able to do that. And you know, with the guidance of the feds and all that, and from the standpoint of replenishment of those dollars or that fund having, because you know, you got to remember, I'm the one that started the fund and everything, and so from the standpoint of replenishing the fund or that fund having a very significant surplus of dollars in it, it's going to have that forever.
All right, thanks, Anthony. Next, we'll go to Brad McElhenney with West Virginia Metro News.
Hello, Governor, or medical experts, or both. When West Virginia raises its number for a picnic or a family reunion or a class reunion to 100, how is that number achieved? Why 100 versus 50 or 100 versus 200? Why that number?
Well, Brad, I can't really say why is that number. You know, if to be perfectly honest, if a gathering of 50, if you have a gathering of 50 and they do all the wrong stuff, you're going to have just as much exposure as a gathering of 100. I get that. But as we go forward, we want to still try as best within us to walk a little bit before we take off running. You know, we could just lift the number tomorrow and say, well, there is no number. But I really believe, you know, capping it at 100 right now, you know, still has us with our hands on the reins a little bit. But as far, you know, Brad, really, when it really boils right down to it, you know, if you do the wrong stuff at 50 or 75, you're going to surely have a significant more, you know, possibility of bad outcomes versus doing the right stuff at 100. And so, but there is no magical cure or magical formula to figure out whether 50 or 75 or 100 or no number's right. You know, but all we're trying to do is just hold the reins just a little bit here and everything before we say it's okay just to lift the number.
All right, thanks, Brad. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, earlier when you were talking about the death of George Floyd and the growing protest movement that we're seeing around the country, you said we as a nation need to improve the way we do things. What do you think needs to be done in West Virginia to ensure that a situation like what we saw there never happens? What sort of police reforms are you and your administration considering right now?
Well, let's think back, and just recognize a lot of different things here. First and foremost, the protest and everything that we've had, or the people that have been voicing, concerns or their opinions and everything, have been great. We've had a lot of love and good stuff happening in those, and that's good. I can tell you from the standpoint of your governor that I have so much confidence in our law enforcement, and they do terrific work. I can't fathom, I absolutely cannot fathom, one of our law enforcement people doing what happened in Minneapolis. However, I would tell you just this. We have a situation in our country too that we can all improve upon. No matter if we thought, the situation, was more, we were more on one side than the other, the reality is just this. We have people that feel like they're not getting a fair shake. And on the other side, we have people that feel like they're doing everything by the book. Now, we can do one of two things as a nation. And you know me, I always just tell the truth. We can keep plowing down the path to where we think we have people that believe that they're being wronged, and plow down the path where people believe they're doing everything right. I trust just this. I trust, especially in West Virginia, that our people together, with people voicing their concerns, our people together, our law enforcement people, as well as our law enforcement communities, all of us working together to try to do better and better and better in everything we do will just make us better. That's all there is to it. It'll just make us better as we go forward. Honestly, the law enforcement community, every person that I talk to just says the same thing. What happened in Minnesota, they can't fathom it. But at the same time, yesterday, we had a person that was on one of our boards that posted some stuff on social media, and we caught it, and basically it was stuff, where he was going to drive, he could drive a truck through a bunch of protesters and this and that and everything. And it was so inflammatory, it was unbelievable. And the very second, that I got that, the very second, I said, fire him right now. Absolutely right this second. We don't have any place for that in West Virginia. And that's exactly what I did. Yesterday, we put out a press release within minutes of when I saw that. Now, so I would say to you just this. Our nation is hurting. And does that mean that one or the other is wrong? No, it doesn't. It doesn't. We may be doing it absolutely perfect from a law enforcement community right now. We may be doing everything perfect, but does that mean we can't get better? Of course not. We can get better at anything we do as we continue to work together and love one another and try to just get better and better and better, especially in this great state. So that's what I want to see us doing.
All right, thank you, Charles. Next, we'll go to Taylor Stuck with the Herald-Dispatch.
Hi all, this is Taylor with the Herald-Dispatch. This is probably a question for Commissioner Jividan. I was wondering what it means specifically to be in quarantine when you're in jail, whether you're someone who is positive for COVID-19 or you're a newly booked inmate and you're in quarantine. Where do those people go when the jails are already full?
Sorry, can you hear me now?
Yes.
So for the inmates that have recently been testing positive that are asymptomatic, they are isolated in their cells according to the CDC guidelines. Anybody that is symptomatic and has medical symptoms is treated medically in our medical units. We basically, when we have a positive, or have quarantined that whole unit as we see what develops and whether symptoms develop. So and we are also doing that with new intakes. People that come in are quarantined for 14 days. We've had these protocols in effect in compliance with the guidelines really since the beginning of March. And I think that's why, you know, we're having success as far as not having the high numbers and being able to contain it. Now that the governor has ordered and directed the enhanced testing and we're catching the asymptomatic cases, that's given us a whole new tool as far as separating inmates who are positive from those who have not yet tested, and from those who are negative, so that we can stop the spread and do whatever we can to keep these preventative and precautionary measures in effect.
All right, thank you, Taylor. Governor, I'll turn it back to you.
Okay, I've got 2 or 3 things I want to run back through real quick. You know, we had questions about the, I think it's called the Medicaid Reserve Fund and everything. You know, I'd like to clarify just this. You know, we have not decided exactly what dollars we're going to need and everything to be able to get to the end of the year and with a balanced budget and all that kind of stuff. However, I want everyone to know just this, that from the standpoint of a Medicaid Reserve Fund, if the federal government, you know, raises the amount of match and everything, and all of a sudden we're just spilling money over in Medicaid, in the Medicaid Reserve Fund and everything, those dollars, we don't need to just have excess dollars. You know, from the standpoint of a decision being made, you know, we're going to use that fund or not use the fund, surely it's available. It's available to us as excess dollars and everything, and we could use it if need be and everything, and we could repay it back, or maybe we'd have another $75 or $100 million. I think that our people yesterday or day before, I can't recall when it was, I asked specifically to our revenue people, between now and the end of the year, how much more will that grow? And I think the answer was right at another $100 million. So you know, I want to clarify that you know, as we use dollars and everything, we are not depleting dollars in the Medicaid Reserve Fund and everything. We are growing dollars in the Medicaid Reserve Fund, and therefore we don't need those dollars there, and we're able to be rock solid on Medicaid and move forward from that. You know, I want to mention, you know, because I really expected a question on this, but I want to mention fraud that is going on with unemployment claims in Workforce West Virginia. And this is going on all across our nation, but I'm just going to report to you just 2 or 3 things, and we're all over this, and absolutely, you know, we will try in every way to ferret out any fraud, and then do everything we possibly can to see that these people are exposed and prosecuted or whatever it may be that would need to be done. But this is going on all across our country. In the last week of April, we received 14,000 applicants, and in the entire month of May, we received 19,000. Now, I want to just read to you just a few more things here real quick. You know, officials think that we have received, I think in the tail end of May and up to now, that we have received 19,000 fake claims. And if those claims had been processed, we would have sent out in a single week of payments $14.4 million of fraudulent claims. Well, we caught it. We caught it. And the thing that is the worst of the whole situation is that people who are legitimately qualified and need their money, this is slowing down the process because we have to go through and scrub and scrub and scrub something that somebody is doing illegally. Now, it's just not right, and there's just no place for it. You know, one local resident has sent in an alleged and has allegedly filed 62 fake claims. You know, like I said, we've always got somebody that's going to do something, that's a long ways from what we should, and that's not very good. I'll end by just saying this real quick, and that is, please, at least over the weekend, keep the people that we've lost, 82 people, in your thoughts and prayers, and think a lot about Senator Bill Hamilton's son, and please do the same for them. And also think about all those lives that were lost in the invasion of Normandy that General Hoyer mentioned. And the last thing I would tell you is always. Well, I need to announce this real quick. We will not have a briefing on Tuesday. That's Election Day. I encourage everybody, go out and vote. I mean, it's your right. And please, whatever you do, try to remember to go out and vote. But every day next week we'll be here other than Tuesday. And so the last of my last is just this is, I started out a long time ago and I read this to you. It's not time to panic. It's time to be cautious. It's not time to be fearful. It's time to be smart. It's not time to be weak. It's time to be West Virginia strong. Now, you have done it. You have produced the numbers over and over and over, and you continue to do it. Absolutely continue to be smart and strong as we go forward. That's what you've got to do, West Virginia, to keep us safe. Anyway, thank you so much, and God bless all of you.